One of the other points, if I had more time to talk at the beginning, was I was going to talk about one of the issues that we face as LGBT communities is that when we hear the word family, in many contexts that looks a certain way. Mom, dad, kids, and that's sort of the only way it can look. Maybe single mom kids. But it doesn't often involve two parents who are the same gender. And certainly there's hardly any discussion about trans parents, and we have lots of those. And so it has to change both from within, because we have to start talking about ourselves as families instead of just talking about just partners. I mean, we are families, and we need to think of ourselves that way. And so when you go to your primary care clinician, you need to say, this is my partner, and we are our family, with or without kids, and start it that way. I mean, we're going to try from the other direction to get people to understand. I'm trying to train people who've been doing things for 20 years. They're a little hard to change, but I'm going to try. That's why I like to start with the student level, because they're much more malleable. But I think we also have to start from within and talk about our own families. Just one other example, just a bisexual plug. I happen to be bisexual, married to a woman, so in the census, I got to say I was married, but that means I count as straight.
Right, and then you're invisible again. On the kind of federal regulatory level, one of the things that the coalition does is we've partnered with other LGBT groups and immigration groups to push for a definition of family in which kinship counts. So it says you have to be related by either blood affinity or kinship. So that way you can really include kind of anyone that you would want under your protective umbrella of family. And there's starting to be a lot more conversation about what it means to be a gender nonconforming youth. And the Washington Hospital Center in DC actually has a great program for parents who have gender nonconforming youth to talk about what that looks like. But we just don't see that kind of replication, and we need to.
Hi, first of all, thank you guys for having me. My name is Jackie Adams. I have been a consumer of AIDS for 26 years now. I was fortunate to get off SSI and get gainful employment. I'm also transgender, to represent the transgender community. I lost my job August 8th, 2008. And first I want to say thank you to the panel, because you touched on a lot of issues that I'm dealing with. I haven't been insured for 2 years. If it wasn't for Ryan White, then I wouldn't be able to get services. So I want to thank you guys for that, putting that in place. And I also want to touch on something that Dr. Nguyen talked about. Since January, we've had 4 deaths in the transgender community, one just yesterday. I have a transgender girl that I'm going to visit as soon as I leave here, that I've been working with for the past 2 weeks with thrush, a CD count of 7, and so forth and so on. And she was part of the adolescent in CHOP, and then when she got a certain age, she had to move to the adult services. I was really touched what you said, Dr. Nguyen, about we have to come up with a better way for the transgender girls to come out and get care and feel like they really cared for. The actual girl that passed yesterday, she utilized every agency, and I want to thank every agency for helping her. It was just her time to go. By the same token, this young child that I'm working with right now don't want to go nowhere because she hasn't had her name legally changed. They refuse to address her as that, and they just refuse to respect her. I had the pleasure of going to Presby with her Monday to accompany her on her first visit since leaving the hospital, and they were really, really understanding. So I guess my comment or my thought is, when it comes to health issues, the T community still feel like they're left out or they're really not included. So again, Dr. Nguyen, I thank you for even suggesting that we have to come up with a better way to include the girl. The 2 girls that I'm actually talking about right now, probably the one that expired, like I said, she had a lot of complications, and it was aggressive treatment. So all was done for her that could be done. As far as these children that I see coming from the youth program graduating to adult services, they were more like breastfed while they was in the youth treatment center. And then when they come out to adult services, they're being called he and this and that, and that's what deter a girl from services. I also had the pleasure of training the CDC. I work with the Police Liaison Committee, so I am a voice for the trans community. but that voice is just not for me to be heard. I speak for the consumer that can't speak. I speak for the consumer that's hidden and ashamed to come to care just because somebody won't call them she. So I just wanted to make a point this evening that we really have to get better with that. Since January, like I said, we've had, what, 4 deaths, Nina? 4 deaths, and it's just because people would not recognize them for who they were. And at one point in my findings, it was Afro-American girls, but as I'm being called on more, I'm finding that there's no racial or ethical. If you're a T girl, you just get treated a certain way. So what I inspire or please beg you guys to do is let's dig deeper in our hearts and know that T women are people too. T women need the same amount of services and respect. If there's a problem with staff members can't respecting that T person, I do an excellent training.